Sometimes the body doesn't announce a crisis with one big symptom. It whispers, a little less appetite, more sleeping, a new kind of confusion. And families often realize later they were watching a pattern that doctors recognize right away as serious. In the next few minutes, I'll walk you through 5 warning signs that, together, can mean an older adult is entering a dangerous decline and may be getting close to the end of life. More importantly, I'll tell you what to do in the moment, what to track, and how to talk to the clinic so you get taken seriously. And stay with me, because near the end, I'll share one simple question doctors use privately that can clarify how urgent the situation really is. If you want steady guidance like this, subscribe to Eldervia for calm, practical tips for older adults and caregivers. Quick safety note. These tips can support good care and clearer communication, but they don't replace an exam, testing, or treatment from your clinician. The first warning sign is a sudden drop in daily function. I don't mean slowing down over a year. I mean someone who was getting to the bathroom with a walker last week and now can't stand without major help, or a senior who was making simple meals and now can't follow the steps. Doctors pay close attention to this because a fast functional decline often signals the body is losing reserve, sometimes from infection, dehydration, medication side effects, heart or lung strain, or a new neurologic issue. What you can do: write down what changed and when, in plain language. On Monday, he walked to the mailbox. By Thursday, he needed 2 people to stand. Take a quick inventory of basics. Are they eating, drinking, peeing, having bowel movements, and taking meds as prescribed? If you can do it safely, check for common triggers: fever, a new cough, burning with urination, new swelling, recent falls, or a new medication. Then call the clinician's office and lead with function. There's been a sudden decline in walking and self-care over 3 days. That gets attention. The second warning sign is eating and drinking dropping off in a noticeable way. Families often hear, "I'm just not hungry," and assume it's normal aging. But when appetite fades quickly, when swallowing becomes harder, or when fluids are barely going in, it can be a sign the body is under stress, or, in some cases, beginning to conserve energy in a late stage of illness. The plain English evidence here is simple. When the body is fighting or failing, it redirects energy away from digestion, and thirst signals can change, especially with certain conditions and medications. What you can do today: aim for comfort and small wins, not big plates. Offer smaller portions more often. Try soft, moist foods like oatmeal, yogurt, scrambled eggs, soup, mashed potatoes with gravy, or applesauce. For protein, a low-cost option is store-brand nutrition shakes, peanut butter on toast, cottage cheese, or adding powdered milk to oatmeal. If swallowing seems unsafe, coughing during meals, a wet, gurgly voice, pocketing food in the cheeks, pause and call the clinician, because aspiration can become serious. Keep a simple log for 2 days, roughly how much fluid, how much food, and whether weight seems to be dropping fast or clothes are suddenly loose. The third warning sign is a change in breathing pattern, especially at rest. This can look like breathing faster than usual, using belly and neck muscles to breathe, breathing that pauses and restarts, or new loud congestion that isn't a typical cold. Doctors focus on breathing because it's one of the clearest windows into how hard the heart and lungs are working, and because low oxygen or fluid overload can quickly affect the brain and kidneys. Here's what you can do right away. Sit the person more upright, even if it's just extra pillows or a recliner. Crack a window or use a small fan to move air across the face. Many people feel less air hunger with airflow. Keep the room cool and avoid heavy blankets on the chest. If they have prescribed inhalers or oxygen, use them exactly as directed, and make sure equipment is working. If you own a pulse oximeter, use it as one piece of information, not the whole story. Numbers can be off if hands are cold or circulation is poor. Most importantly, note what's new. Short of breath at rest, can't speak full sentences, breathing is irregular, because those details help clinicians triage. Midway reminder, keep watching, because the fifth sign is one many families miss until the final days. And the response isn't more effort, it's a different kind of support that can bring real comfort. The fourth warning sign is a significant change in alertness or thinking. This might be new confusion, agitation, seeing things that aren't there, reversed sleep patterns, or unusual withdrawal. Like a senior who suddenly stops chatting, stops recognizing familiar routines, or can't stay awake. In plain terms, the brain is sensitive. Low oxygen, infection, dehydration, uncontrolled pain, constipation, and medication effects can all tip someone into delirium. And delirium itself can be a marker of serious illness. What you can do: first, don't argue with confusion. Anchor it. Use calm, short sentences. Turn on a lamp in the evening to reduce shadows. Make sure glasses and hearing aids are on, because poor vision and hearing make confusion worse. Offer sips of water or ice chips if safe, and check for constipation, urinary problems, or missed medications. If confusion is sudden, treat it as urgent and call the clinician the same day, because it can signal infection or another acute problem. The fifth warning sign is the overall shutting down pattern. Sleeping most of the day, speaking less interest in food and fluids, cooler hands and feet, changes in skin color, and swelling that comes and goes. This is the cluster doctors recognize, not one item alone, but a trend that the body is conserving energy and circulation is changing. In many cases, this happens late in advanced illness, but it can also occur during severe, treatable problems, which is why you still call and describe the pattern clearly. Here's the practical step most families don't think to do. Ask the clinician, kindly and directly, if things continue on this path, what should we prepare for in the next days to weeks? Some clinicians call this the preparation question. It opens the door to honest planning without forcing anyone to predict an exact timeline. And if comfort is the priority, it may lead to a conversation about palliative care or hospice supports that can reduce suffering and bring equipment, nurses, and guidance into the home. Let me tell you about Raymond and his daughter, Lisa. Raymond was 82, proud and private. Lisa noticed he stopped walking to the kitchen, then started eating only a few bites. And then came the nighttime confusion. He was trying to go to work at 2 a.m. She felt guilty, like she was failing him. Instead of guessing, she wrote down 3 days of changes and called the clinic with specifics. Function down, intake down, confusion up, breathing more shallow at rest. The nurse didn't brush her off. They adjusted medications, treated constipation, and brought him in for evaluation. Later, when it became clear his heart failure was progressing, Lisa used that preparation question. It didn't take away the sadness, but it replaced panic with a plan, and Raymond became calmer once symptoms were managed. Here's a simple routine you can start tonight, even if your loved one is stable, because it makes the next phone call and the next decision easier. Take 5 minutes and create a one-page snapshot. Write the current medication list, allergies, major diagnoses, and the clinician's phone number. Add the baseline, what normal looks like for walking, appetite, and thinking on a good day. Then do a gentle evening check-in. Offer water, help them use the bathroom, set out nighttime meds, and look at breathing while they're resting. Just observe. No stress. Finally, place a notepad and pen where you can grab it. So if something changes overnight, you can write down the time and what you saw. That tiny habit prevents the "I can't remember when it started" problem that delays care. If money is tight, you don't need fancy supplies. A basic thermometer is helpful, and many dollar stores carry one, though drugstores may have more reliable options. For nutrition, store brand shakes can cost less than name brands, and you can also blend milk, banana, peanut butter, and oats for a budget smoothie if swallowing is safe. For comfort, extra pillows, a rolled towel to support the side, a small fan, and a nightlight can make a big difference without costing much. Small habits can boost results, too. Keep lighting soft but steady in the evening to reduce confusion and falls. Dim screens at night and avoid loud TV if someone is agitated. Encourage sips through the day instead of big cups at once. Keep pathways clear, especially to the bathroom, and consider a motion sensor nightlight. If you're the caregiver, set an alarm to drink water yourself. Caregivers get dehydrated and miss details when exhausted. Now, the clear red flag moment. Seek urgent care or call 911 if there's chest pain, severe shortness of breath at rest, lips or face turning blue or gray, new weakness on one side, sudden trouble speaking, a hard fall with head injury, uncontrolled bleeding, new seizure, or a person who becomes very hard to wake up. If your gut says, "This is not okay," trust that and get help. So let's pull this together calmly. Doctors don't look for one dramatic sign. They look for a pattern, a sudden drop in function, a noticeable decline in eating and drinking, new or worsening breathing changes, a shift in thinking or alertness, and the broader slowing down cluster that suggests the body has less reserve. Your role isn't to diagnose. Your role is to observe, write down what changed, support comfort, and communicate clearly so the right level of care can happen at the right time. If you're watching this as a caregiver, I want you to know something. Being prepared is not the same as giving up. Preparation protects dignity, it reduces suffering, and it helps families make decisions with steadier hands. In the comments, tell me one thing you're noticing right now. Changes in walking, appetite, breathing, or confusion. And I'll share a practical next step to discuss with the clinician. And please share this with a family member who may need it, especially the one who's not sure if it's serious. Subscribe to Eldervia for calm, practical tips for older adults and caregivers. Educational only, not medical advice. Please speak with your clinician about your specific situation